Do you see it says, I do not remember anyone working in the centre or who was part of the conversations who had a detailed understanding of the way the NHS operated. This is not unusual or unique to that time. Social policy and the operational management of the state is always underrepresented in the centre of power, whereas the Treasury, foreign policy and national security are overrepresented. Just going back to the first sentence, you say you don't remember anyone working in the centre or who was part of those conversations who had a detailed understanding of the way the NHS operated. Yeah. Given all we've heard about the importance of the NHS, and not just in terms of caring for people, but the detail, whether it was going to be overwhelmed or not, that's a very striking statement.
Yes, was an observation at the time and is striking in retrospect as well. I think it probably goes to what needs to be different in the future, is that it oughtn't be possible to kind of start from that primary level of ignorance. It causes problems, and it was something we felt very strongly at the time, that just actually having people who were literate in the NHS would have been more useful.
No doubt there were attempts to educate the Prime Minister, his advisors, his ministers in the way the NHS worked, and we've seen, for example, Simon Stevens came to meetings, of course, Chris Whitty. But was that a sticking plaster that did the job, or do you think there was still a deficit that actually led to imperfections in policy decisions?
I think if you were starting again, you might think quite differently about what is the skills and expertise and knowledge that ought to be available immediately for a Prime Minister to help support them on the business of the day, whatever it is. So, for example, there's been a military attaché in the Prime Minister's private office for a very long time, for very good reasons, because when the Prime Minister is taking decisions which relate to the deployment of the military, then having somebody who can sit right by the side of the Prime Minister and translate and explain and bridge that gap is very important and useful. Not my place, and I wouldn't be suggesting there need to be a series of attachés. What I'm saying is that I think this is an endemic problem, that having more actual operational and detailed experience of important things for our country, it'd be better if the Prime Minister could have those in-house, as well as, yes, absolutely always should be relying on the Chief Medical Officer and the Secretary of State for Health, because what, in my view, you don't want Number 10 or the Cabinet Office ever to be is a sort of mini replication of the entirety of Whitehall. Good government works when everybody is doing their jobs well and the centre is doing its job well, and trying to recreate everything in the centre of Whitehall, as I think probably this experience shows in a pretty gruesome way, does not work.